Hey, I'm Dr. Matt Geller. I'm here with Dr. Linda Chou. She's a private practice owner in Minneapolis, Minnesota. And you do pediatrics in a huge way, right? And
Right.
contact lens specifically. Tell me all about that.
Well, usually around middle school, kids start wondering about contact lenses.
Aha.
And parents are always a little apprehensive. There's that question, when is the magic age, for contact lenses? And there is no magic age, right? I look at two things. One is motivation, and the other is responsibility. And by motivation, I mean, is the child really interested in wearing contact lenses? As you might expect, there are a lot of parents that are more interested in their child wearing contact lenses than the child is.
For sure.
Especially for sports, if they're a gymnast or a dancer or a skater. A lot of times the parents will say, it would be really good if you had contacts for that. And the child doesn't want to have anything to do with it. It never works.
Oh.
So motivation is key. And the other is responsibility. And by responsibility, when I talk to the parent, it's not, do they take out the trash and walk the dog or make their bed? It's the responsibility of knowing that they need to tell mom or teacher or school nurse or me that there's something wrong. Are you not seeing well? Are you not feeling good with the contact lenses? Are you having problems in any way with the contact lenses? You need to tell somebody. I remember from my own experience in high school when I first got my contact lenses, I would have put rocks in my eyes if I had to, and actually they were PMMA, so I did put rocks in my eyes. But I didn't want anybody to know if I was having a problem because I was afraid they would say to me, you can't wear contact lenses anymore.
Yeah.
So I pull out an old Tyler's Quarterly and I go, look, these are all the contact lenses that I have to choose from to help you. So don't think that if you have a problem with these trials that we're starting out with, that you won't be able to wear contacts. Complain to me.
That's an important message.
Talk to me, yeah. And kids learn early with me, so you can blame me 10 years later when you have a complaining patient. Oh my God, they must have seen Linda
You
Chous,
did it. So this is like the perfect blend between two of my favorite modalities, pediatrics, which really takes a skilled practitioner, someone with that good bedside manner, and contact lens, which it's not always soft lenses, it's some of the more complicated lenses.
Yes, absolutely.
So what a good modality. What's your message to grads who maybe want to enter that or merge those two?
Well, be open to it. Have the discussion with the child or the parent, because they're thinking, oh, you have to be 16, or that there is some magic age that we haven't reached yet. And unless you talk to the parent or the child, they're not going to know. And it only takes, all it takes is, have you thought about contact lenses? Especially when you go into those lifestyle questions about the sports that they play, or the hobbies or activities that they do that might lend themselves very well to contact lenses. What I find in my practice is a lot of kids start out with contacts for sports, and so the daily disposables, that's all we do, and it works really well in those cases because they can always carry a pair in their backpack, and so they're always available for the sports. But once they start wearing them, they start wearing them full time.
Do you feel like it's easier to get dailies onto a pediatric patient or just the younger teen than it is on someone who's a bit more mature?
Well, I think the fact that they're starting out, sometimes it's hard to get people to change when they've gotten used to something, so I think with kids. And the other thing is, I think there's a fear out there that the parents aren't going to want to pay for daily disposables, but I'm going to tell you, there have been very few parents that haven't. When I mention daily disposable, you can see them go, they're glad because they're not going to have to worry about whether the child's keeping them clean, wearing a ripped lens, all of those things, because a lot of these parents are contact lenses wearers, and they know, what you can do to be bad, and they're afraid that their child is going to be in there. There's a lot of risk taken away once we put them in daily disposables. Yeah.
Sure. So I guess if someone is thinking of going that lane of their career, is it kind of like you put a stake in the ground, you say, I'm doing pediatric contact lens, or is it kind of this natural evolution?
So I have to say, when I opened my practice, I was expecting to see, this was back in 1991, and I was expecting to see a lot of new myopes, because I really wanted an alternative to other places where the parent might go and feel less confident in whatever setting it was when they got that that letter from the school nurse. I wanted somewhere where they could feel comfortable bringing their child.
I see.
So, and not just me, but the setting of my office and how it was designed, it was very, family friendly. What happened was I started seeing all these 2-year-old accommodative esotropes, right? So, I was seeing all these plus kids.
Wow.
And kids with high astigmatism. And eventually they got to the age where they wanted contact lenses. And I was oftentimes limited to the lenses that I could suggest for them because of the parameters that were available.
Right.
Because everybody was plus with 3 diopters of sill. So it was an evolution, I guess, as my patients aged. I eased more into contact lenses. So probably initially when I first started practice, I wasn't doing as much contact lenses as I did as I started seeing more and more older patients. And older for me is 8,
Yeah, for sure. That is older, yeah. I don't think any practice could be successful without some form of marketing, whether it seems deliberate or it's kind of just, oh, I didn't know that was marketing, I must be marketing.
Sure.
How does a doc get their name out in the community, especially to this niche segment of the population?
Early on in my practice, we did all kinds of advertising because we didn't know what else to do.
Right.
Nobody knew who we were or where we were. But what happens when you start talking to the parents and you start fitting children with contact lenses, especially if you're maybe fitting them a little earlier than most, a lot of practices would if they're like 8 or 9 years old and you're starting to mention it to them, the word gets out, and parents talk, and of course kids talk too, and so it's almost internal marketing, and then you have your patients be your word of mouth it's inexpensive and it works wonders because it's testimonial, it's private testimonials.
Would you recommend that at the end of an exam a doc says, hey, do you mind telling the community about me, or is it deliberate like that? Or do you just hope that they do it?
I'm kind of like, hey, whatever works.
Yeah.
And that's a great way to do it.
You got to attack it a little bit.
You don't get what you don't ask for, right?
So you miss 100% of the shots you don't take, right?
Exactly.
It sounds like a very fulfilling line of business, so to say, or a career, modality path. Any cool stories?
I think one of the interesting things that has happened with my practice is I started with a niche pediatric practice, and then as the kids came in and the moms were coming in, and I'd start developing relationships with the moms, and the moms started saying, can I come here? And it's like, well, of course you can. I'll examine you. And so my motto has been, we see big kids too.
Yep.
So
I like that.
So what has happened, I've developed this secondary niche of moms that are around the age 40 and early 40s who are looking at bifocal contact lenses, who are experiencing dry eye, and it's almost like a little secondary niche that I've developed because I started seeing their children. And so it's opened up my practice to other areas too that can be just as interesting as working with kids.
I love it.